but hopefully now we are talking about the gut system. There is so many different kinds of the systems are existing in our body. The one of the system to be known as a great and biggest system in our body to be known as a alimentary system. No doubt the integumentary system, also known as a derma system or the skin system. And apart from that, this is the internal organ related conditions that to be considered as a biggest organs which is existing in our body, that to be known as a alimentary system or abdominal system or abdominal cavity or the peritoneal cavity. So this is in fact which is existing in front of you, this to be known as a gut as well. From the mouth to anal region, anal canal to be known as a gut system, but still the major gut to be known as a, which is in front of you, that to be known as a large colon. There are the colon or the two, one to be known as a small colon, the second to be known as a large colon. So or there another name to be known as a large bowel, right? So this is in fact, where is it exactly located and what is the physiological aspect and what are the structure of this large intestine? We will look into that and then further we'll move on to the subject. Now which is in fact the gut is the major role in our body for the why is it so important? Whatever we ingested of the food, either drinks or the water or the food, so that will goes to the stomach. From the stomach it goes to the small colon, then it goes to the large colon. So maximum quantity ingested of the food to be absorbed and then supplied in the form of the nutrition in the small colon itself. Later that will pass to the large colon. In fact, whatever absorption to be taken place in the small intestine, remaining absorption is not there, that goes to this large intestine. From the large intestine it absorbs the entire which is not absorbed in the small intestine. So therefore that will extract. So we consume, for example, 1 liter or the 2 liter or 3 liters. Some people consume the 4 liters of the water or any form of the hydration to the body system. So that time that will not be excreted totally through the colon, but that will maximum absorb in our body, that convert in the form of the hardness. The stool is passing eventually, but the stool is not that semi-solid, not the watery, but that to be like a humidity and solid and then dampness kind of the feces, defecation to be taken place. But when it will not absorb by the small intestine or the large intestine, that will be passed through the colon in the form of the water. But of course, there are the numerous etiology and pathogenesis are there. That also we look into that. Why is it causing that problem? But normally, according to the physiological aspect, but it absorbs the nutrients and also unwanted material that will be eliminated through the colon. Right? This is the major physiology. Where exactly this colon is located? Of course, there are the navel, on the navel region, superior to the navel, towards the navel. You understand it is normally located on the waist. Waist is, the under the ribs, below the ribs, and then where the hip bone is there, innominated bone. This is the waist. From the waist region where the ascends on the upward direction, do you know there is a stomach? Stomach is connecting to the small intestine. The first part to be known as the small intestine is duodenum. So after the duodenum it connects here. After the duodenum, jejunum and then ileum. After the ileum, that will connect to the cecum. That connect to the Cecum. Cecum is the first part of the large intestine, which is the connecting to the small intestine to the large intestine. So that to be known as a, you can have a look, this is yellow color. Yellow color part which you can see on the board, on the, that to be known as a cecum. So that is the connecting from the small intestine to the large intestine. That is the beginning part of the large intestine, which is located on the right iliac fossa, which is located on the right iliac fossa. When the patient is complaining, I do have the pain. How you can recognize it is kind of the pain is on the right side, that indicating 3 chun distal to the navel and 3 chun lateral to the navel approximately. Right? So this region to be known as a right iliac region. From there it ascends to the upward direction. From there it ascends. Ascends means it goes upward direction, then it going towards the hepatic organ. Hepatic organ is liver organ. It ascends to the upward direction on the right side. Then where the liver is located, exactly just on the 7th intercostal space, from there it connects to that sphincter or that area. From there it transfers the colon, that bifurcate the colon from the on the upper part of the below the part of the stomach region. Then it moves on the lateral position. From there it again descends to the downwards direction. Again it descends to the downwards direction, but this region is connecting to the splenic texture. This is the hepatotexture, this is the spleen texture. From the below the spleen, then it descends the downwards direction, and then on the left iliac fossa. From the left iliac fossa, how the right iliac fossa? Left iliac fossa. From there it descends to the downwards direction, that to be known as the S-shaped sigmoid colon. From the sigmoid colon it descends the downwards direction, that to be known as a rectum. The rectum is connecting to the anal canal, that to be known as a anus. Right? So this is the pathway. So which is the small intestine? How many feet of the small intestine is existing in our body? Which is the large intestine is larger or the small intestine is the larger? So how many feet or how many meters of the intestine?
15 meters small intestine.
Very good. Nearly 20 to 22 feet larger or longest of the small intestine, but perhaps in the children have that kind of, the adults having the 22 feet of the small intestine, whereas in the large intestine to be known as a 5 feet of the large intestine. For example, meters we wanted to convert, 6.5 meters nearly is the small intestine, then 1.5 meter to be known as a large intestine. Such a great level, how the human being, what is my height? That much height, that large intestine is there. Right? From there it encircles in the different place. You understand how many pathways are there that will get stagnation, that get the stenosis, that get the blockages. People says, I do have the bowel irregularities, I have the constipation, something like that. But where the process to cleaning that process, what is required? Hydration is required. That's the reason called as a hydrocolon therapy. The name also given, hydrocolon therapy. Hydro means is the water, colon means is the intestine, and therapy, that cleaning of that system to be known as a hydrocolon detoxification. So therefore now we remembered that this is the entire part to be known as the beginning part I told you is the cecum. The downwards, the cecum, there is connecting one tube. That tube to be called as a vermiform appendix. So that appendix that doesn't have much role, but if when the people consume lot of things, that sometimes it get inflammation, that gets the bulginess or some kind of the irritation in that vermiform appendix, which leads to the pain. Where do you get pain? Only on the right iliac fossa. RIF, RIF, you remember, RIF, RIF means right iliac fossa, you will get the pain. If you'll get the pain on that region, then perhaps don't take it super simple and then easy. Yes, perhaps I'll give the dicyclomine hydrochloride or the antispasmodic medicine you are providing. Then the patient still says that I do have the pain. Then it's once you touches on that region, patient feel is doesn't allow you to touch on that region. That means that much tenderness are there. So that time is immediately we need to refer to the laparoscopic surgeon. Let he analyze what exactly the pathology. Based on that, if at all required, the surgery can be taken place. Otherwise, if the mild to moderate inflammation is there, then further with the diet and he need to maintain that. Chances are that I have treated couple of the cases without doing the surgery. And also we need to understand by using one acupuncture point to understand whether it is the normal abdominal pain or the only the colon pain or really it is the vermifuge appendix pain. That time you recognize by using the one single point, that point to be known as a Lan way. Lan means is the appendix, way means is the stomach. Then you try to find out that particular location, where exactly located. So 2 chun distal to the Zu Sanali, or the 5 chun distal to the lateral part of the eye of the patella, 1 finger breadth lateral to the border of the tibia. So that particular region on the leg, you try to find out. That is an extraordinary point. Hopefully you understand. Lanwei, Lan way. So this particular point, try to give the pressure. So that time the patient can recognize that perhaps he do have the pain, because that particular area is connected the interior energy pathway of the colon. Sir, how do we recognize? Colon is somewhere, but you are telling the point is somewhere, but how this point is interconnected? That means the interior energy pathways, the large intestine meridian pathway, it goes to the from the lungs, it connects to the colon. From the colon, it goes to the downwards direction. From the downwards direction, it's connecting to the on the distal to the knee region, where the energy get terminated. That energy terminated place to be known as a Shang Juksu. Shang Juksu. Shang means is the colon. Juksu. That means is the one stomach 37 point. That particular point it get terminated, but just that area to be known as a stomach 37 and then stomach Lan V, that area to be known as a Lan V area. Vermiform appendix area. So that time we recognize certainly he do have the appendix pain. So that time treat by using that particular point itself. When the patient is complaining that, when the patient having the pain, so that time we try to understand the pain is in this region. When the knee below the knee, the pain is in this region, then you try to understand. Yes, you just give the needle on that region or give the pressure to that region. The patient feels certainly changes. Right? So in this way we try to understand that appendix pain or the normal pain. Then it goes to the cecum. From the cecum is connecting to the large colon. That large colon to be known as a ascending colon. Ascending colon. From the ascending colon, then the feces, it absorbs whatever the nutrition is there, still nutrition is there in that, or some kind of the food substances is there, again it will absorb, then it passing to the transverse, this to be known as a transverse colon or horizontal colon. Then again that horizontal colon descends to the downwards direction, that colon to be known as a descends, that means is the downwards direction, that to be known as a descending colon. Then after the descending colon, then it goes towards the medial side of the abdomen. So that to be known as a sigmoid colon. From the sigmoid colon till sigmoid colon, It absorbs the nutrients, it absorbs the unwanted substances, and water absorption to be taken place, and minerals absorption to be taken place with the support of the bacteria. So nearly 300 to 1000 different bacteria are existing in the colon. How many? Nearly 500. Make it as a 300 to 1000. It depends on the person to person, but good bacteria are existing in the colon. Normally those bacteria to be known as a streptococcus bacteria or staphylococcus bacteria, and also clostridium bacteria, lactic acid bacteria, lactobacillus bacteria. These bacteria are good bacteria. When flora should be good, that the bacteria should be good. So therefore that bacteria are supporting for the defecation and also absorption to be taken place. So because the bad bacteria are there, that also very bad. If these bacteria are passing to the other organs, that causes the problem. If those bacteria are existing in the colon, those bacteria to be known as a good bacteria. So from there, sigmoid colon, then it goes to the rectum. It goes to the rectum. So normally the colon, when the patient says that the temptation is there, that means I have the intention to pass this stool, but that means is the sigmoid colon is entered your feces. From the sigmoid colon, it's entering to the rectum. That means it entered to the rectum, and then rectum it stores. Rectum, it stores of the stool. Then after that, when the signals will get in the anal canal means around 3.8 centimeter. 3.8 centimeter. You remember, this is for example 3.8 centimeter where the forefinger length. So that much anal canal is there. So through that anal canal, that get the sphincters. Sphincter means is the muscles. That those muscles to be known as a internal muscles and external muscles. Internal sphincters, external sphincters. That means you remember there are the muscles are there external, but external you have given the command that please you just come out my stool. We feel that when it's coming out, right? When the signal should provide from the brain. So that to be known as the internal sphincter. So internal sphincters open the muscles, then the external easily will open. So it will not open because it's not under our will, which is under our will is the external and internal is not under our will. So how the autonomic nervous system, sympathetic nervous system, parasympathetic nervous system, but the ANS can be regulated by the brain system to open the internal sphincters, then it passes the stool clearly. Right, that's the reason why the people sit for half an hour in the stool, in the washroom, especially WC. They have the very relaxing period on the stool. The people says, I don't get anywhere in the relaxation. I do get only relaxation when I sit in the commode. अम्मा बैठ रहा हूँ भाई, आधा घंटा मुझे किसी की परेशानी नहीं है. तो कभी फोन लेके बैठता है, कभी लैपटॉप लेके बैठता है, कभी बुक लेके बैठता है, कभी न्यूज़पेपर लेके बैठता है, कभी किसी से वॉशरूम से ही बात करना शुरू कर देता है. अरे गधे, वो नहीं करना है आपको, ठीक है? That's really not so good. So you understand, because that is not under our will. Patient says that मुझे relax होता है, wanted to go and sit for the longer time. So that leads to the, now we look into that, the colon related problem, related to the anal related problem. Normally says I do have the piles, fistula and then fissure. These are the three major problems normally will get by the large intestine, especially the rectum and anal related problem. Right? So why is it so? Now I come to the from this region, from the appendix region. Appendix, there is a inflammation, we understand. Then come to the colon related problem. The colon is very much essential to get the lubrication timely. Because I told you how many meters of the Colon. 5.5 meters of the colon. Sorry, 1.5 meter of the colon. So therefore, once to clean that entire process, but of course some lubrication is required in terms of the two things. Number one, are you eating the high rich fiber food? Number one. If you are not, then certainly it causes the dryness in the colon. Number two, when you are hydrating to your colon in the form of the water, either in terms of the juice, wheat grass juice, or the ashgard juice, or the ABC juice, etc. Right? Anything are you consuming, or the soup you wanted to drink, like a vegetable soup, especially good, something like that, you need to hydrate to your body, right? You need to hydrate to your body, especially to the colon. Hydrate to the colon. So once you do the hydration, then the movements will be good. Slowly the movement, because it's not the straight line that once you drink the water immediately it goes, but there is the zigzag type internally. There is a round type of the square type of the colon is there to pass on to from one place to other place, but it takes time from morning to evening. How do you keep it, your hydration of your colon? That's very imperative. So later period, if this will get the dryness because you are not sufficient water is nourishing to the colon, so that time it get hydrated, it's not hydrating, get dehydrated. So that time it get contracted of the colon. And when you give the pressure, due to that pressure, sometimes it causes the bulges of the colon. That means is the enlargement of the colon. Constipation, you remember, it is the accumulation, excessive colon energy causing the constipation, not the deficiency of the energy in the colon. Therefore, once it get accumulated, but you are not hydrating, that will get the bulge, that to be called as a diverculitis. Right? So, diverculitis, that's called as a inflammation of the colon. External inflammation of the colon is not totally internal inflammation, it is the external inflammation of the colon. So that causing some kind of the dryness and then inflammation, and this is one kind of the problem, again because of the transverse colon, but of course very less amount of the descending colon and sigmoid colon got the accumulation. Perhaps, for example, you are having the food nearly 2 to 2.5 kg of the food every day. But elimination also should be happen around 1 kg. 1 kg has been gone to the nutrition. At least 1 kg elimination to be taken place. So did happen the same? No? Then it is the retention. But every day it is getting the retention. That retention is that causing the problem in the sigmoid colon. From the sigmoid colon, that happening on the rectum region. From the rectum, it gets some kind of the sensation, but still there is a more stiffness on that region, and also the brain is not giving the signal because that's got more dryness on that region. So due to that dryness, the sphincter of the anal region is not opening precisely, that causing some kind of the piles related problem. When there is the piles is happening, that means there is the rectal, anal, veins are there, and circulation to be taken place with the form of the blood vessels, that gets the bulge. That gets the problem. Venous gets the bulge. The veins which passing to the anal canal, that get the enlargement, but that is related to the piles. That perhaps is the internal piles and then external piles. External piles we call as a hemorrhoids. Hemorrhoids. Hem means H-A-E-M. Hem means blood. right? So the bleeding taken place in the colon, perhaps before or the post completion of the defecation will get bleeding, that bleeding to be known as a hemorrhoids. This one kind of the problem, this called as a beginning or the first stage of the problem of the colon. So try to correct it before itself. If it is not corrected, then that will convert in the form of the fistula. Fistula, again, it is the more inflammation, more infection in the colon. Patient feel not only the bleeding, but at the same time he feels that pus formation also going out through the anal region. When the pus is going out, then you remember some kind of the mucus is going on. Mucus mixed with the pus is going on, and also bad odor is there, that you can recognize it is the fistula. Then again there is another complication to be known as a fissure. When the fissures is happen, then you remember the anal canal got scratches internally, that leads to very burning sensation and also very pathetic and acute pain patient feel, and he very excited, very fearful to go to the washroom. He don't want to step into the WC. What is WC? WC known as a Western come out, or the water closet. Yes. So these people are very feared to go. That means that much pain, pathetic pain. Once they pass the stool, then the whole day they have the burning sensation. So all are related to the some kind of the problem. Even today, I am not very sure about the people homosexuality or the gay system or the gay sexual activities or the homosexual or the heterosexual. That heterosexual people do the coitus and intimacy in the anal region. All are really why it is refrained to do the sex on the anal region. Remember, all are leads to the complication as well.